Pulse diagnosis, there are 6 positions, 3 on each arm, or 3 on each hand. We're taking the radial pulse here, where it says Sun Guan Chi. On the right hand, we have the lung in the Sun position, the spleen or the pancreas in the Guan position, and kidney, or right hand kidney Yang on the Chi position. Again, we're going from top. The Sun is most far away from the center of our body, so we have the upper part of the body. And then as you come closer, you're going down towards the kidneys in the lower part. For the left hand, we have the heart in the Sun, the liver in the Guan, and the kidney Yin in the Chi position. So then at each of these positions, we're not only going to look at one spot, we're going to look at 3 different levels within it. We're going to feel where we barely put any pressure, that's a light touch, then go deeper, that's a medium touch, then go deep for the heavy touch, or heavy touch for the deep position. That'll tell you where the chi is. That'll tell you what's going on. Like I've said before, I love taking people's pulses without them telling me anything and predicting what's going on with them. It's really fun.
Can you tell us?
We can do stuff when we do the practical at the end. Yeah. There are 28 different types of pulses that you learn in traditional Chinese medicine school. Of those, maybe half are really useful in everyday practice, but there are 28 that they teach you. But on top of that, there are so many different styles of pulse diagnosis. The one that's taught here in school is probably the easiest to learn, and it works really well. But if you want to be really good at pulse diagnosis, you can go onto different styles. There's people who teach some really cool pulse diagnosis stuff. And when I graduated from school, I was like, oh, this pulse diagnosis we learned here, it's okay. But then I started taking people's pulses like all the time and just predicting what they had. And I was like, oh, wow, this really does work really well. But maybe not as well as some other styles.
Is it similar to Ayurvedic pulse?
You know, I don't know enough about how Ayurveda does pulse diagnosis, but I'm sure there's similarities, and I'm sure there's differences. So some common pulses. There's floating pulse, where it's felt at the superficial level only. And then when you push deeper, you don't feel it at all. Versus a deep pulse, where you don't feel it at the superficial and middle level, and you go deeper, and that's where you find it. And no. Superficial usually means that there's an external condition going on, like a common cold. And the body's chi has gone to the surface to fight it. Hence the pulse is at the surface, at the superficial level.
Okay. You did mention that the acupuncture, you can easily manipulate the chi if it's superficial as well.
It's easier to manipulate the chi from the elbows to the hands and from the knees to the feet because the chi runs closer to the surface, yes. Deep just tells you that the chi is internal. It tells you whatever condition is going on is more inside versus the outside surface being attacked. And we look at, is it slow or is it rapid? Slow just tells you cold, rapid tells you heat. Is it thready where it's really thin? That just tells you it's a deficiency of some sort. That's where the diameter of the pulse isn't really wide, it's thin. Is it slippery where it feels, the description is pearls rolling on a plate, which I feel doesn't say anything. But it feels like boba. Like boba rolling underneath your fingers. You guys know what I'm referring to? Boba is, what is it again? It's the tapioca balls in that drink.
Okay. Those are huge.
Yeah. Well, not that big, but I just mean it's like it has
The
this
texture.
The texture has that slippery feeling to it.
Oh.
Yeah. Slippery tells you that there's dampness, or there's phlegm, or there's food stagnation, Or there's pregnancy. You can predict if someone's pregnant based on the pulse. Or sometimes it can be heat. That's less common. By the way, you can predict a child's baby if you're really good at pulse diagnosis. Or you can predict the sex of a child in utero.
How would you feel what's the difference between male and female?
I don't know enough to tell you. But I will say this, I have correctly diagnosed 1 for 1.
Good for you.
But I have a 50-50 chance. Yeah.
So it's not specific every single time, it's like depends.
No, some people are just really good at it and they know. I don't have enough experience to really be able to do it. Wiry is where it feels like a guitar wire, like really strong, like a wire. That tells you liver qi stagnation or pain, because in pain they're constricted, or phlegm. I find this one not as common, but it can be phlegm. Phlegm because it's blocking the flow of qi and leading to qi stagnation.
I'm curious about, I was kind of waiting towards the end to see if you would cover it, but like different pulses that are bold throughout different parts of the body.
That are bold? What do you mean by?
Like a bold, like the same pulse that you would feel, like, you know how you feel your heart pounding?
Yes.
What about those types of pulsations in different parts of your body? What
Yeah.
does that mean?
Yeah.
I'm curious.
I don't think I really have an answer for you, but I've got something tangential. In old Chinese pulse diagnosis, they used to diagnose the pulse in many different positions. There's inguinal pulse, there's the carotid artery, there's pulses on the legs and on the feet, and they'd use that to diagnose, but it's very invasive, it's not very respectful, and especially in old Chinese culture, it was very inappropriate to do that, especially with female patients. So even at one point it got so taboo that what people would do for pulse diagnosis is they would put a string on the pulse and feel the string and take the pulse there. Crazy.
Interesting.
Yeah. And there's, in one of the classes you'll learn where all those pulses are. I don't really remember too much about them. But I don't know, I don't have an answer for you in terms
Are
of
they
what it means.
indicators of anything? If you feel a stronger pulse in certain parts of your body, just like say you were laying down and you feel just a pulse, you're calm, no external factors, and you feel pulses in your hands like really strong, or like in your abdomen, your stomach, or in your throat. Does that mean that there's blockage in there, or deficiencies, or can it help aid you when you're assessing with the other 5 elementals? Or
It's hard to know one way or the other. I would go to more biomedical explanation of it, in terms of like sympathetic versus parasympathetic nervous system. Different parts of the body are getting more blood flow or less blood flow. But then there could be like an energetic thing going on, like for instance your hands having strong sensation. Hands are very good at feeling energy. It's one of the primary ways we feel energy, for instance. Or you could look at chakras, like is it in my heart? Is maybe your heart chakra is too open or too closed, you know. But for the most part, I'd go to the biomedical explanation. Yeah. Choppy. A choppy pulse is described as a knife going down a bamboo stalk, where it's like it's not smooth. Like it'll go and then it'll like get stuck, and it'll go and it'll get stuck. So choppy will change pulse rate. It'll go faster and slower, and then it'll be stronger and weaker. All of that will go. That usually tells you blood stasis or blood deficiency. The blood stasis is the blood gets stuck, and so it's holding back, and then it breaks free, and that's the alternation of the feeling of the pulse. The blood deficiency is from a different angle, where it's the same thing happening, but the blood isn't filling in, so you don't feel much, and then the blood fills in, and you feel it, so it's changing like that. Choppy pulse is interesting. So those are some of the really common ones. There are combo pulse diagnoses, or there are multiple pulses going on at the same time. Here are some common combinations. If it's floating and rapid, the floating tells you an exterior condition, the rapid tells you heat. So we have an exterior wind-heat going on, because wind always precedes heat or cold or whatever it is, like we talked about in the first or second week. Is it thready, deep, and slow? When that's going on, thready tells you deficiency, deep tells you internal, slow tells you cold. So literally, it's as easy as putting these things together. Some students really get lost on, oh, there's all these things, what's the big story of how it works? But if you just know what each little piece of it is and put that together, internal deficiency cold for thready, deep, and slow, you automatically know it's yang deficiency because the only type of deficiency cold there is a yang deficiency. When it's a wiry in the left guan position, the left guan position has to do with the liver. So then that tells you there's liver qi stagnation happening or some sort of liver disharmony. Or is it choppy and wiry? That tells you there's blood stasis and qi stagnation. Possibly blood deficiency and qi stagnation, but blood stasis is more common. Yeah, Gianmarco.
Is it very common to have combo pulses? Do a lot of people have that, or is it?
Yes.
Yeah.
Yeah, there's usually all sorts of different things going on. Yeah. The normal pulse, by the way, is not too fast, not too slow, not too strong, not too weak. Regular in rhythm, you know. And nobody has a perfect pulse. Yeah. Yeah. I'd be interested to take like monks' pulses. That would be fun.